Today we will discuss a very common topic when patients say, I have bad teeth or I have no teeth at all. What to do? I will try to explain to you in the simplest terms what to do in various situations. The first thing I want to talk about is the situation of having no teeth. What to do if you have no teeth? In such a situation, there are only two solutions. This is the so-called removable structure. Or the second solution is a non-removable structure on implants. If we talk about a removable structure, it is the technology of making a non-removable structure. Most often we talk about acrylic. A denture is made, it is also called a suction denture. Some even call it grandma's dentures. That is, it is a kind of removable structure that the patient fixes by themselves, removes by themselves. That is a removable structure. What are the pros and cons of this structure? Probably the cons can primarily include the fact that such dentures may not hold well. Not for everyone, but they may not hold well. Of course, this is inconvenient, a rather large and foreign object in the mouth. Undoubtedly, this is an inconvenience in wearing, but people, by the way, do get used to it. Therefore, the main drawbacks are, of course, the fixation and such a certain bulkiness in the mouth, making it very, very difficult for patients. Probably, by the way, one of the cons is that it's difficult to get used to such structures. If we talk about the pros, the advantage is that it is made very quickly within a maximum of a week. The cost, of course, on average, probably the cost of such prostheses ranges from 15 to 50,000 rubles. It all depends on the clinic. Well, the average price, if we talk about our clinic, a removable prosthesis costs 35,000 rubles with us, regardless of whether it's the lower jaw or the upper jaw. Therefore, the advantages include, of course, the price as well as the speed of production. No surgeries or implants are needed. It is easily installed for the patient. We solve the problem. The chewing problem is resolved in any case. The patient can chew, and of course, aesthetics are restored. The patient can confidently smile without embarrassment. So these are the advantages of this design. If we talk about technologies, let's say in non-removable constructions on implants, then here, well, the main disadvantages. Of course, most often it is the price for patients. Not everyone has the money for such constructions, probably. Let's say one of the disadvantages is the price. And of course, there are certain indications, undoubtedly, certain conditions under which, let's say, it is contraindicated. There are, thank God, not so many now, but nevertheless, one of the disadvantages can be attributed to, let's say, certain contraindications due to certain conditions. And of course, one of the disadvantages is still the surgical intervention. It is a surgical operation, let's call it that. And this also scares many people off. Even though there is no need to fear it now, nevertheless, it can still be considered a disadvantage. The advantages of this technology are that it is non-removable. That is, unlike a removable denture, once we install it, it does not come off or fall out. It is very small in size, so there is no need to get used to it, or the adjustment period is just a few days. And speaking of the price of the construction or prosthetics on implants, the cost, let's say, ranges from 190 to 350,000 rubles. I am by no means urging anyone. Sometimes we read in our comments, patients write to us, and we see, let's say, an element of slight negativity. We are by no means urging anything. It is only your decision. Everyone decides for themselves. And the second situation, I have bad teeth, what should I do? In fact, this interpretation, bad teeth, a large number of patients talk about it. That is, they, let's say, reveal problems with their teeth by saying, I have bad teeth, what should I do? What I can advise, if you think so, and it seems hopeless to you, I have bad teeth, doctor, help. The first thing to do, of course, is diagnostics. That is most often, as soon as we take an X-ray, then most of the teeth can be restored. And this is very important. Sometimes a patient thinks that with bad teeth, there's a lot to be done. Probably need to remove them. probably costs a lot of money. Therefore, in no case, first an X-ray is taken and we usually determine that the problem is not that severe and everything can be resolved. And most importantly, restore your teeth, which will serve you for a very, very long time. The second thing, Ishti, you need to do is, of course, schedule a consultation at a dental clinic, either the nearest one to you, one recommended to you, or one you like. Read about, it's up to you, any dental clinic. Schedule a consultation with a doctor. Sometimes, by the way, you can schedule an appointment with more than one doctor at once. Nowadays, getting a second or third opinion in medicine is absolutely normal. Therefore, you can schedule appointments at several dental clinics and accordingly listen to what they tell you, remember, and take note. For those who don't have this opportunity now, quite a few clinics can provide consultations remotely, the so-called telemedicine or remote consultation. Therefore, you can also send your image somewhere via email to some service that is specified at the dental clinic. Most often you will always hear about quite a large volume of these works. That is, sometimes even several stages are ahead. This should not scare you in any case. For our patients, if we are talking about our clinic, we try to break down the treatment plan step by step. And sometimes, let's say, this rehabilitation process, it can indeed last even several years. So never be afraid of this. The most important thing is to approach it systematically and according to plan. Start from a certain side sometimes. We usually do it this way. We first address the issue on one side of the upper and lower jaw. We restore the chewing function on one side and calmly. We let the patient go for several months and sometimes even for a year so that the patient is prepared financially or let's say morally. And then they come back and we restore. The next stage is the chewing function on the other side. And again, we calmly let the patient go. And only then does the patient come for beauty, the so-called frontal part of the teeth. Unfortunately, the rules are such that you need to restore the chewing functions first, and only then aesthetics, beauty. And only then do they come for beauty. Therefore, I will say once again, do not be afraid under any circumstances. Understand, break down, and fragment your treatment plan for yourself, and calmly, systematically move towards your goal, your new smile. But still, if the teeth are bad, and the doctor confirms it, let's say with diagnoses, let's call it that, bad teeth and teeth will need extraction then. In such cases, in our clinic, we try to offer what is called immediate implantation right away. If the patient has the financial capability, of course, for immediate implantation, then we remove and immediately place an implant, restoring the teeth. Here, either with crowns, or a removable denture, or a partially removable denture, or with implantation and crowns on the implants. I hope, thanks to our video. You now absolutely and completely understand what to do when you have no teeth at all, and also when you have bad teeth. So subscribe to our channel, like the video, and take care of yourself.